Uh, Perfect. Hi, everyone. My name is Helena. I use she, her pronouns. I'm the Reproductive Health Law Fellow at PWN. I am based in Minnesota, and thank you for joining us tonight for our Positive Women's Network Policy Fellowship graduation for our 2025 to 2026 cohort. Just logistics. This is being recorded and you can enable enclosed captioning. Please share any questions that you have in the chat. You can also raise your hand and we'll take questions at the end. We are on meeting mode on Zoom, so you can mute and unmute yourself using *6 or the mute button on your phone. All right, we're so excited for graduation. So the agenda is as follows. We're going to do a quick welcome. Kelly's going to lead us through why we do this fellowship and why it's so important to have this policy fellowship at Positive Women's Network. And then we're going to hear from two of the most incredible policy fellow alumni that we have, Myra and Meta, and they're going to share a bit about what this policy fellowship has meant to them and then their experience this year being co-coordinators and really helping to bring this policy fellowship to life. So much gratitude for them. And then we will have our practicum presentations, and that's where each of our fellows will have 5 minutes to share a little bit about their project and what they've been doing for the last 6 months. And it is so incredible. I'm really excited. They've put a lot of hard work into this. And then we'll close with some more music. Each fellow submitted a song, so we have some tunes that we can play and just spend time together. So super excited to have you all here. All right. For those who don't know and that may be new, and this is like your first time joining us, the Positive Women's Network, we are the only national membership body created by and for cisgender and transgender women, gender diverse people, and transgendered people living with HIV. Since 2008, our members have created a unified voice and built collective power for women, gender diverse, and trans people living with HIV. We believe that racial and gender justice cannot be divested from the HIV response and ground our work in collective liberation. PWN is creating a world where all women, gender diverse, and trans people living with HIV can live long, healthy, dignified lives free from stigma, discrimination, and criminalization. And one way we do that is through this policy fellowship, and it's integral to our policy work. So I will hand it off to Kelly, who is our policy director at PWN, to share a little bit about how this program started and why it's so important for us here.
Beautiful. Thank you, Helena. Hey, y'all. My name is Kelly Flannery. I use she or they pronouns. I'm the policy director at PWN. And if you know me, you know I'm kind of like a sweatshirt, t-shirt girly. So I had to bring out my sequins for this one. I am so thrilled to have something so wonderful to celebrate. It has been a really challenging political environment. It has been challenging in folks' personal lives, in their professional lives. And this fellowship has been such a source of joy, creativity, and life for me as someone who's watching it. I'm really glad that you're here today to celebrate with us as we welcome a new graduate class. So a little bit about why the fellowship. So first off, the fellowship started before my time at PWN, before I came in. I came in what is Helena's now position as a fellow. And it started in 2017 by Arnita Rogers. And she developed this fellowship in acknowledgement of three core facts. The first is that people living with and communities most impacted by HIV, specifically here we're talking about Black and Brown communities, queer and trans communities, immigrants, poor and working class people, have been structurally and intentionally excluded from tables where policy decisions are made. At the same time, fact number two, we know that policies have better outcomes for our communities when those who are most directly impacted by decisions are the ones who are making those decisions, right? Nothing about us without us. And then the third is that PWN members are endlessly brilliant. Given the right tools, given the right opportunities, PWN members have the experience, connections, and the vision to transform systems towards our collective liberation. So this fellowship at its core is an investment towards all of our liberation. We've built out the curriculum to dive into the technicalities of policy work, but not just the specifics of like how does the government function, what is a policy, who controls what. We also built into our curriculum liberatory frameworks that ground PWN's policy analysis. We talk about racial justice, gender justice, and reproductive justice as core to how we pursue policy work. Over the course of this fellowship from 2017 until now, we have had nearly 100 cis and trans women, gender diverse people, and trans people living with HIV as policy fellows. The PWN Policy Fellowship really has been a springboard into leadership, both within PWN. Former policy fellows are chapter leaders, state leads, comms fatties, PWN staff, and in fact, the current coordinators of our current fellowship program, and a springboard into leadership outside of PWN. Our fellows have leveraged skills, networks, and experience gained through this program in order to get employment in public health, advocacy, and community health organizations. They've served on important committees like Ryan White Planning Councils and PACHA, the Presidential Advisory Council on HIV and AIDS. Our fellows have are published writers on health policy and in notable papers and in health magazines. In fact, some of our policy fellows have run for elected office successfully. Some have led statewide volunteer campaigns, started HIV decriminalization coalitions, worked to end the criminalization of sex work, led and organized statewide coalitions to improve care in their state, including creating an innovative rapid response mechanism to address emerging policy and advocacy issues. PWN policy fellows have created advocacy days, have provided public comment, advanced legislation that will improve the lives of people living with HIV, started nonprofits in their communities, former PWN fellows have actually started the first national movement accountable for people who identify as lifetime survivors of HIV. And former policy fellows are leading major organizations, are co-executive directors of major organizations in the HIV movement, including the two current co-executive directors of PWN, Marnina Miller and Ebony Turk. So we do this fellowship because it nourishes us, it nourishes the community, and it's creating a world that is going to respect the health, rights, and dignity of people living with HIV and all the communities most impacted by HIV. And Helena, with that, I'll pass it back to you.
Thank you so much, Kelly, for that beautiful background and grounding. I think that was so lovely and really lays out the importance of this fellowship. And this year, we actually had a really incredible opportunity. So before I came on as a fellow, I came on in September 2025. PWN was able to hire on two former fellows who could work as co-coordinators. So it was really the first time we've had folks who are alumni become co-coordinators and really help us revamp the curriculum and have their input and expertise on this. So it's been, I have to say, one of the most valuable experiences to be able to share time and space with Myra and Meta. I've learned so much from them. So much gratitude for those two. And so I would love for them to share a little bit about their journey as policy fellows, post fellowship, things that they've done, and what it has meant to them to be co-coordinators this year. So Meta and Myra, off to you, whoever wants to start us off.
Yes, Myra, go ahead. Myra,
Myra, I think you're muted.
Okay, can you hear me now?
yes, we can hear you now.
Okay, Meta, would you like to start this party?
No, actually, I came off of mute to ask you to start, darling. But if you would prefer me to start, I will. You knew I was going to do this. I don't know why you
I
play.
knew you was gonna do this. You told me you was gonna do this. Okay, so anywho,
All
okay,
right, you
well,
lead.
my name Myra Franks. I am from Fayette, Alabama. That's rural Northwest Alabama. My pronouns are she, they, and I am the outreach coordinator for the Alabama chapter of the Positive Women's Network. I was in the policy fellowship year 5, and I was just getting started with PWN actually at that time. So I felt really inadequate and unprepared for all of the information that I was getting. I did a fact sheet that year, and getting the information and preparing that fact sheet with the help, I had a lot of help from both Barb and Sally in doing the research and stuff, because it was an experience. You know, sometimes the numbers were overwhelming, but we got the fact sheet together, and at the end of the day I was still feeling kind of inadequate. And it was about how the money for HIV services trickles down into the state of Alabama, and the rural areas were left out. So I had a long talk with my superiors about that, because I felt like if I really brought all that to light, that the rural areas might not get any funding. They could pull back the little bit that they were getting. But it's kind of come full circle now because of the things that are going on, that we're seeing going on now in Alabama, with how um, they do not respect, nor do they wish to learn about the principles of MIPA. That's the first thing. Um, they're not including anybody to how they operate. We found out that they did not have any turn in any numbers for ADAPT that was with the CDC, wasn't it, Helena? If you remember that. So there's a lot going on in Alabama that we need to address. And since we are now pushing back and have some support, we could go ahead and I want to pull that fact sheet back out and redo the numbers and let them see exactly what's going on in the state of Alabama, because this is really something that needs to be addressed when it comes to the policies in the state of Alabama. No one should be left behind. And I have learned a lot from these fellows. Their tenacity and their willpower, their go-get-itness. They came up with some really phenomenal ideas about policies, and they did it. They did the damn thing for real. You're going to be amazed when you hear some of the ideas that they came up with, and how they plan to implement them in their state, and how they are already implementing them, and how other organizations are getting on board with them, because what they are doing are such great ideas and everything. And I have just been it was a privilege. Congratulations, policy fellows. It has really been a privilege to me to be in your midst. And congratulations again. And I can't wait to see what the future holds for you. Now, Meta?
Well, hello, everyone. I am, let me first
Oh,
say,
shout out to our policy director, Kelly, and also our policy reproductive justice fellow, Helena. I don't know what I would have did without y'all some days, trying to maneuver life, seeing that I couldn't multitask. Much love to all of you. Now
okay,
to
I
Meta.
guess I'm up now. All right. Well, my name is Meta Smith Davis, and I am a Black senior citizen woman living with HIV for more than 20 years, 20 plus years. And I was a policy fellow in year 2, and I got real familiar with Kelly, y'all. Baby, I was kind of new to advocacy. I had the fortune, the Black Jesus blessed me with the opportunity to work at a CBO where I was able to make a difference in the lives of Black women living with HIV. And I'm forever grateful for that, forever grateful for that. And the project that I did was, I wanted to do my project was trans rights in Louisiana, that they weren't protected here. And I wanted to do a focus group with trans women, but I wanted my agency to give $50 gift cards for it. So I called Kelly, and I called Kelly, and I called Kelly. but I really did. I really did go to my executive director, create a plan. When I wrote it up, he told me what I needed to do, why I was so headstrong on stuff. One of the things that the fellowship did for me was gave me an opportunity to realize that I could do things. I could do things. It really did. Because I was really, really new and I was really, really afraid. And Kelly made it seem like a cakewalk. And I want y'all to know that the last year has been truly, truly, truly an upheaval for me. And I want y'all to know, I want the fellows to know that I'm grateful that I had the opportunity to be here because it was part of my saving grace. And I want my team to know that them weekly meetings, even the ones I wasn't on, y'all, saved me. I have been going through a lot of mental issues and I'm getting better. And I want that to be apparent because I want Black women to know that it's okay not to be okay. I'm getting there, but I'm not there yet. I'm enjoying spending time with my granddaughters and my great granddaughters, and it's giving me a sense of peace. My peace is not negotiable anymore. And y'all taught me that. The women from PWN taught me that. We became a PWN chapter in 2015. So we just celebrated our 10-year anniversary last year. And I want y'all to know that it was a true honor to be a part of this fellowship. Because I want y'all to know, and most of y'all know I cuss a little bit. Y'all was badass. Y'all was doing shit. And when I was in year 2, I was like, oh my God, how am I going to be able to help these people? Y'all were truly badass. Y'all came from an amazing place. Y'all had amazing organizations to support you, and not to be. Well, okay, so I'm being biased because I'm from Louisiana. I really want to shout out Zena and Millicent. All right, I'm a little biased. Sorry about that. But I want y'all to know that this fellowship has been my saving grace. I want y'all to know that y'all have been my saving grace. Helena, Kelly, Myra, y'all are truly, truly what it means when God says he got a ram in the bush, y'all been my rams in the bush. And I'm eternally grateful for it. For all of it, for all of it. And I wouldn't have traded it for nothing in the world. When Kelly called me last year, that's when my downfall started happening. And I was on the phone going, I know she got to be kidding. She can't be want me to lead shit. But if she thought I was good enough, that was good enough for me. And I want y'all to know that if somebody believes in you, trust that. Trust that. All right, I'm gonna get off now because they're gonna tell me to stop talking after a while. All right, I'm gonna give it back to you, Helene.
Wow. Thank you, Meta and Myra. One, just incredibly beautiful. Two, you have showed up with such dedication, grace, and kindness through it all. Um, and I think folks really need, like, I want to give you your flowers because I think we need to celebrate you too. Um, Thank you for all that you've done for pouring into this community, even when it was difficult for you,
Yeah,
truly. Um,
yeah.
so
Y'all
much
made that
gratitude.
possible. Y'all made this possible. And the fellows that are on this call, I really want y'all to know how much gratitude I have for y'all. It was because of y'all that I was able to push through on those times when I couldn't push through. Thank y'all so much. Thank y'all.
Thank you, Meta. Thank you, Myra, for your vulnerability, dedication, grace, um, and just your light. Thank you for being such powerful people. It is a privilege to watch you two shine. Okay, now we will get into our practicum presentations. Each fellow will have about 5 minutes to share what their project was about. And they're going to do this in different ways. So we gave them creative liberties here. Some people have slides, some people don't. So it'll be whatever comes up for folks. We want to stick to the 5 minute dead limit just so that everybody is able to present. So Kelly will be helping me keep time, depending whether I'm sharing slides or not for the fellows. But okay, are y'all ready for this? Are you excited? Yeah. That's what I like to see, Kelly. Yeah. Okay, perfect. So up first, we have Dianye Dior. And while Dianye gets ready and we make Dianye a co-host, I'm going to stop sharing and pull up Dianye's slides. So give me just 1 minute, folks.
Well, hello everyone. I will go ahead and wait while I wait for Alina to pull up my slides. I'll go ahead and introduce myself. My name is Diane Dura Valentina, and I use she, her, AI pronouns. My practicum project is called Trans Futures, the National Story Making Advocacy Toolkit. As a young Black and Brown transgender woman, I created this project because I really wanted to ensure that transgender and gender extensive young people we're not just being talked about in policy conversations, but we're really helping shape them, right? So this project centers lived experience and translates those experiences into tools that advocates and policymakers can use to advance health equity. Next slide, please. Across the country, we see, we know, we hear it all the time, trans youth and young adults are facing tons of barriers to care right now. Many participants in the study described losing Medicaid coverage, struggling to access gender-affirming healthcare, facing housing instability, and navigating discrimination within healthcare systems. But at the same time, these experiences are often missing from policy discussions, right? So I really wanted to create a project that documented these realities and transformed them into policy-relevant insights. Because when we fail to center lived experience, we miss opportunities to build policies that actually work, especially for young people. Next slide, please. I think you went 2 slides. We went 2 slides accidentally, I think. You can go back 1 slide. Can you guys hear me?
We can. I think Helena's working it out on her end.
Just 1 second, Diane.
There we are. Perfect. Thanks so much. During this project, I was able to recruit and document 14 different stories from transgender and gender extensive young people from the ages of 16 to 29 across the US. The participants represented diverse racial backgrounds, geographic regions, and experiences with HIV. I then developed a toolkit that translated these stories into policy themes, recommendations, and advocacy tools. And a major priority throughout the project was ethical storytelling. So participants were able to use aliases, participants maintain control over their narratives, and also engage through a trauma-informed process. One of the biggest project milestones that we've had so far was presenting it nationally at AIDS Watch in 2026 this year. And we have also already been referenced by Lambda Legal in an ongoing legal proceeding that they just launched yesterday. So this is huge for me, and I am so happy about that. Next slide, please. Several themes were very consistent across this project. Participants described Medicaid terminations caused by administrative barriers. Others had insurance, but still could not access medically necessary care. Many discussed geographic barriers that limited access to HIV providers or affirming healthcare. Others named housing instability that also appeared repeatedly as a factor that affects healthcare access and treatment adherence. But I think what stood out most to me was that these stories came from different communities across the country, but they all had very similar barriers. The biggest lesson I learned is that storytelling is more than just a personal narrative. Storytelling is qualitative policy evidence. And these stories help us understand how policies function in people's daily lives. Next slide, please. One more. Yep, there we go. The Trans Futures Project will continue to evolve. Future work includes expanding the story bank with more young people, continuing federal policy advocacy, training advocates on ethical storytelling, supporting community-led reform. This toolkit is really intended to be a living advocacy tool. Next slide, please. So, as part of this practicum, I developed a full advocacy toolkit that expands on everything I've shared today. The toolkit includes participant stories, includes key findings, ethical storytelling practices, policy recommendations, and resources for advocates and community leaders. So if you're interested in learning more about the project, I encourage you to scan the QR code and explore the toolkit. And I'll also have Kelly drop that in the chat for me. One of my goals was to create something that would live beyond this fellowship, a resource that organizations, advocates, policymakers, community members could really continue using long after the project was actually completed. So what started as a practicum project has now become a a tool for elevating lived experience, strengthening advocacy, helping people understand how policy decisions show up in everyday life. So my hope is that this toolkit continues to spark conversations, it continues to build partnerships, and it continues to support efforts to improve outcomes for transgender and gender expansive young people living with and impacted by HIV. Last slide, please. So as I close, I want to take a moment to thank everyone who helped make this project possible. Thank you to PWN for really investing in my leadership throughout this fellowship and creating space for fellows to develop projects that are meaningful to our own communities. Thank you to Age United's Transgender Leadership Initiative. They funded the project. Thank you to Advocates for Youth for really helping getting me in contact with young people. They helped really shape that. And they also helped create all the beautiful content that you see, the slides, the toolkit itself. They really helped me design that. So thank you so much to Advocates. Most importantly, thank you to the transgender and gender expansive young people who trusted this project with their stories. A few of them are on here today. And their honesty, their vulnerability, and their courage are the reason that this project exists. And this practicum reinforced something that I have always believed, right? And that is the people closest to the problem are often closest to the solution. And when we create opportunities for people to share their experiences safely and authentically, we gain insights into things that statistics cannot provide. So thank you all for your support throughout this fellowship journey. I'm excited to see where this work goes and grows from here. Thank you so much.
Thank you so much, Deania Dior. Can we please drop some flowers in the chat?
Without a doubt. That was amazing. That was amazing. Amazing.
I'm proud of you, sister. You did it.
Thanks, Madon. I love you. And thanks to everyone who's on here supporting me.
You did an amazing job, Deania.
Incredible. Please check out the toolkit, folks. Kelly dropped it in the chat.
Truly amazing. Truly amazing.
Just exceptional.
All right. I told you it was going to be incredible. Okay. Up next, we have Nikisia. And I will be screen sharing.
Yay. Okay. Can y'all hear me okay? Okay, great. So hi, my name is Nikisa Jackson. Hi Olivia. Shout out to the Well Project. They helped me with this project. I'm so excited about it. I'm Nikisa. I've been an HIV advocate, not by it kind of just happened. I shared my story in 2017 after being diagnosed for about 9 years, and it's been up ever since. And this project is very near and dear to my heart. So I titled it We Have Babies Too. Improving care and advocacy for women living with HIV that want to have babies. Okay. So can you go to the next slide for me? So what's the big deal, right? What's the big deal? So the big deal is this: pregnancy and childbirth can be very life-changing, and it also comes with challenging experiences, especially for Black and brown women. And once you add HIV to that, it can even be more complex and scary. Now, just with my experience of like knowing other women living with HIV, sometimes they find out around the time they get pregnant, and then, can you hear me still? I just hear like people talking.
Yes, ma'am. I
Okay,
can hear you.
Okay, great. I just heard people talking, so I just sorry. So, so back to what I was saying. So sometimes you find out when you're pregnant and it's already a lot going on, and then you add having HIV.
Can everybody mute if they're not
Yeah.
Nikisia, please?
Nikisia, I just muted
Yeah,
everyone.
I'm muted. I got it. I muted. Thank you. So while there are protocols around not transmitting HIV to the baby and making sure that the woman is healthy, there aren't protocols around providing support for those same women or preparing other women living with HIV for their next pregnancy or their first one, because every woman that gets diagnosed with HIV is not already pregnant, but they desire to have children. We're living longer, and I just feel like this is something that is just missing from the field. And so that is what that's what's the big deal. So can you go to the next slide? Okay, so the requirements for the program that I'm proposing, we should have education on preconception, pregnancy, childbirth, and postpartum care for women living with HIV. They have to have assistance with access and resources. Every program that is created should include people living with HIV in meaningful leadership roles, which we'll touch on that in a minute. These women should have access to trained doulas and support birth workers with HIV specific training. Um, and the availability of educational programming during appointments, not only during pregnancy, and development of individualized birth and postpartum care plans. Because every woman going through pregnancy is not the same. Every woman living with HIV is not the same. So they should be able to work one-on-one with a peer to develop a individualized birth and postpartum plan. Can we go to the next slide? All right, so let's talk about the meaningful use of people living with HIV. We don't want it to be like, oh, I got a person living with HIV on staff. I got a person living with HIV that comes around. No, it has to be meaningful use. And also, my framework is based off of that, and also the use of Black women. During our policy fellowship, we had those two specific trainings stuck out to me the most. And so I feel like it should be incorporated into this framework. So some examples of meaningful use are like the counselors, the doulas, the educators, the people who develop the programs, the advocates, and the consultants. That has to be required in order for your program to get funded to meet this requirement. Next slide, please. So this is my policy recommendation. HIV healthcare providers should be required to implement a comprehensive educational and support resource plan for women living with HIV who are pregnant or planning to become pregnant. And they're big on planning to become pregnant because because I feel like that's a big misconception. Well, not misconception, that's a big piece that's missing because it's already a lot of stress with knowing you have HIV and you're pregnant, and there are different protocols that we have to follow that you may not have to follow, that you don't have to follow if you're not living with HIV. So and this it's just we just have to be included. We only got 5 minutes. We can go to the next slide. Am I frozen? Okay, I think I'm back now. Okay, the Giving Life program. So this is my proposed intervention. It's a state-funded initiative designed to support women living with HIV before, during, and after pregnancy. It combines education, peer support, and doulas together, and it provides them with all the necessary tools and resources to navigate pregnancy confidently, understand medical protocols, and be able to advocate for themselves. It's very hard to advocate for yourself when you don't have enough information. It's very hard to do that. And I myself have experienced having to advocate for myself, but I have a background in healthcare. So I have a one up. A lot of people don't have that background, and that should not be a requirement when you're wanting to have a child. Next slide, please.
And that is 5 minutes.
Okay.
If you want to
Well,
wrap up.
that's it. In conclusion, I want to do abstracts with this. Yeah, I can wrap it up. So that's just an intervention recommendation. People get connected to doulas. I can send this link out to people if you want to read more. But I do plan to do an abstract on this to take this to the next level, and really take the Giving Life program to the next level. And thank you so much for this, and shout out to the Well Project for making it possible. I did not know I was going.
That was incredible. So much love for you. That was such a great project.
It absolutely was.
Amazing.
That was wonderful,
Great
Nikki.
job.
It
Great
was wonderful.
job.
It
Great
was
job.
wonderful. Like I said before, y'all got some great ideas. Phenomenal, phenomenal people.
All right. Next up, we have Hughes. Are you ready? And I think you will be screen sharing, correct?
Yes, that's correct.
Perfect.
Let's see here.
Are you able to screen share now?
I think so. And I'm just grabbing that screen. Let's see. Okay. Can everyone hear me?
Yes.
Yes,
Okay,
great.
fantastic. And you can see my screen?
Yep.
Okay, good. All right, I'll go ahead and start. Hi, everybody. My name is Eve Chu, he, they pronouns. I'm a trans person living with HIV. My project is about medication lockers, which is expanding safe and dignified access to HIV medications. This is a policy based in San Francisco, especially because we have so many unhoused folks and people with housing instability and lack of access to medications. I thought this would be a great project for my city. So the problem is that there's, yes, again, housing instability, limited pharmacy hours, transportation gaps, and stigma and privacy issues when it comes to people getting their medications consistently. And so we're trying to find the solution for this problem so that people can have access to their medications regularly. Who is most affected are women and gender expansive people living with HIV because we face stigma and structural barriers that disrupt access to consistent HIV care. People that experience housing instability, which I have experienced in the past, so they have no safe and private place to store medications. Those deterred by stigma for HIV positive individuals and people with transportation and schedule barriers. What is the proposed solution? Well, we are proposing community-based lockers. These are secure, client-controlled medication lockers placed in trusted community settings across San Francisco, such as a clinic, which I am working with San Francisco Community Health Center. They are looking to implement this at their Polk Street location, which is specifically for trans people. So this gives extended availability, so access outside standard clinic and pharmacy hours. This is on patient terms, not institutional schedules. There's a low threshold and it's dignified. So no appointment needed, minimal paperwork, no stigma. It's preloaded by care teams and retrieved by clients privately. This is a harm reduction framework where it meets people where they are, reduces structural obstacles, and centers autonomy and self-determination. What is the policy path? Well, I am looking to meet with the SF Board of Supervisor members to present this proposal. I'm looking to introduce a board resolution to secure city and county funding for a pilot. This pilot would be at San Francisco Community Health Center's trans-focused location as the inaugural site. And this is a scalable model, meaning that we can hope to replicate this throughout the city. So our partners, Positive Women's Network, organizational home for this initiative, we have a shared commitment to equity and self-determination, rooted in the lived experience of women and gender expansive people with HIV, provides advocacy, infrastructure, and community trust. SF Community Health Center is the other partner, and they're very excited about this medication locker pilot. Again, we're looking to serve the trans community specifically first, and it's a trusted community setting with existing care infrastructure. Oh, these are hard to read, so I should have made them in black. I thought I did, but that's okay. Grounded in harm reduction and health equity. So we meet people where they are. We remove structural obstacles to staying on HIV treatment rather than asking patients to navigate around them. We centered self-determination. So client-controlled access restores agency. People retrieve their own medication on their own schedule. There's dignity without stigma. So there's no surveillance, no bureaucratic friction, no judgment, access designed around the person, not the institution. Equity as architecture. So designed for women, trans, and non-binary people living at the intersection of multiple marginalizations. What are the anticipated public health benefits? we are anticipating an increase in medication adherence, a decrease in emergency department visits, and a decrease in system costs. So this is what like legislators like to hear, is that overall a decreased costs. But for us as a community working in HIV advocacy, we know that this supports long-term health outcomes for our HIV positive individuals, improved viral suppression, reduces hospitalizations driven by missed doses and interrupted treatment, stronger continuity of care for people with unstable housing or unpredictable schedules, and again, long-term cost savings. So we decentralize medication distribution. It's scalable and replicable. We build systemic trust, and it's a national model. Next steps are going to the board of supervisors, finalizing my host agreement with my clinic, and looking to pursue city budget allocation, federal health equity grants, and philanthropic support. And that's mostly about it. Yeah.
Well, all I can say is they better watch out for you. I know that. I know that right now. That was really, really amazing. It's inclusive. It covers housing, disability. I mean, everybody has a place. I thought it was amazing. Thank you so much.
Thank you so much. I really appreciate that.
I second that. Equity, what was that? Equity is architecture. That's beautiful. That's like poetry. I want to hear more about that. I love that so much.
Yes, I third all of the responses. Congratulations.
And received some requests in the chat to learn more.
Okay, great.
Opportunities to connect. So
yes, congratulations.
Yeah, a wonderful model. Thank you for sharing that with us. So brilliant.
Yeah,
thank you.
Brilliant.
And next up, we have Brooke, who I will be screen sharing for.
No conversation about HIV can start without dandelions. For those who don't know, dandelions are people who are born HIV positive. Next slide. My practicum is to get PrEP into OBGYNs when women are in there for birth control so that we don't have to be diagnosed pregnant. My host committee was the American Academy of HIV Medicine. And I came up with a best practices sheet for doctors' offices to push these talks into OBGYN discussions about birth control. Next slide. Girls just want to have PrEP. They just don't know it yet. I was a peer educator in an HIV clinic, and I made a PrEP wall for the women who were coming in with all sorts of other STDs, and they were not being educated that they were on birth control. Maybe they should look into PrEP because statistically we know that they are at risk. However, doctors, and I don't know why, OBGs are not telling people, and they're only testing us once we're pregnant. And so the stigma and the trauma that it causes to the fetus and to the woman is bullshit. Next slide. Missed opportunities. From 2022 to 2024, between 54 to 65% of women are on contraception. They have to go to the doctor every single year to have a pap smear, to have a refill, to have a discussion about their sexual health. So why isn't this coming up in their discussion about sexual health? Yeah, the 60 million people, a 60 million person a year missed public health opportunity. Next slide. Unprepared. In the US, 20% of new positive cases are coming from 13 to 24-year-olds. They have the lowest PrEP usage, and only 6% of high school youth have been tested for HIV. Next slide. Why PrEP for girls or women? It is 99% effective when taken correctly. It puts women in charge of their sexual health. It is safe. It can be used during pregnancy, breast and chest feeding. and women represent 1 in 5 new diagnoses in the US. Next slide. Prevention gaps. As we all know, Black and brown women are not tested, they are not educated, they are not told, they get ignored, and it's also bullshit. If we educate people when they come into offices, then we don't have to have catch-up care. We can have preventative care because we know that all of you are more likely to acquire HIV. The knowledge is there, the silence is louder. Next slide. Why is the moment now? 89% of new positive cases in women are from heterosexual contact. With cuts to Ryan White funding services and ADAP formulary changes pulling all medications, we do not need more women who are relying on Ryan White to survive. These programs are already being purged from the positive populations that are growing nationally and locally across the country. Next slide. We need to shift the narrative from risk to prevention. Everyone who has condomless sex is HIV possible. Self-controlled HIV prevention is medical self-care. We are not always in control of when we have sex or who has sex with us. Partners cheat. They don't always wear condoms. We are not in control of any of that. We can control PrEP. We can take a pill to prevent ourselves and protect ourselves. Next slide. Call to action. How can you integrate PrEP into your clinics? Where are the gaps that you see? Make prevention feel like self-care, not risk management. HIV risk languages misses HIV possible people every day in clinics. Next slide. And we're going to end it with a song. Oh, that's a duplicate of that.
Yes. I love these commercials. I love it.
We prepped. Woo. It's the time for empowerment, and I've got a message for you. You gotta think about sexual health, no matter what, when or with who. Yeah. To all you lovers out there, ain't no judgment. This is your cue. Yeah. It's time to talk about pre-exposure prophylaxis, a part of HIV prevention. Oh, so you prep. Yeah, don't keep it on the down low. Let all of your people know. So you prep. Yeah, don't keep it on the down low. Be proud to let your partners know. So we prep. Yeah, don't keep it on the down low.
And that is 5
Let all of your people know.
Way to go, Brooke. That was wonderful. And just so y'all know, Brooke has a poetry blog too.
Yes, yes. All
Yes,
of our
she does.
fellows are so talented. And thank you,
That was
Brooke, for that.
amazing.
Amazing, amazing.
Thank you, Brooke.
Incredible. Thank you so much, Brooke.
Y'all are really doing it.
You're very welcome.
Next up, we have Denise. Over to you.
Wow.
Yay. Do I have screen share capability? Okay, we'll see. Good evening, everyone. Thank you for this wonderful program. I've learned so much in a short space of time. The little 5-minute presentations went fast, but they were exciting and interesting. So I'd like to just say that I'm This project documents, this is a practicum on Ladies First on the Front Lines for Justice. And this documents the planning, implementation, and lessons learned from Ladies First conference and translates those experiences into best practices guide for advocates interested in organizing similar events. So who's Ladies First? Ladies First is a women-led advocacy initiative focused on HIV criminalization, reform, and decriminalization. The initiative centers women living with HIV and other impacted communities through education, storytelling, community engagement, and policy advocacy. And why this project matters. HIV criminalization laws continue to contribute to stigma and misinformation and can discourage testing, disclosure, and engagement in care. And this project was designed to increase awareness and create opportunities for dialogue and action around reform efforts. It was done collaboratively. My host committee, the person that I worked closely with was Melanie Reese, and she also was a part of this conference. So it was a conference held over 2 days. One day featured a virtual panel, which that was Melanie was in that panel, and it focused on HIV criminalization laws in Maryland and in New York, and the differences between, because I just moved to Maryland and I noticed that things were quite different there. So we were bringing together those two states, and it happened to be about individuals living with HIV and their shared experience, and they discussed some reform efforts that impacted those communities. So I want to just make a note to say that we're pleased to feature Melanie and on our day one panel because Melanie shared her experience working with fellow advocates and partner organizations through the Maryland Coalition to decriminalize HIV to help advance the Carlton R. Smith HIV Modernization Act. Her participation provided attendees with real-world examples of how coalition building, persistence, and community leadership can lead to a successful legislative reform. And then day two, we had an in-person event at the LGBT Center in Manhattan that included a keynote speaker, panel discussions, community dialogue, and opportunities for networking within the coalition. So how we planned it and the resources we used, it was funded through partnerships, and we had logistical coordination, and funding was provided through the Health Not Prisons Collective, which awarded up to $7,500 to support HIV criminalization education and awareness efforts. And the funds were distributed through Zero Project, the fiscal sponsor for the U.S. HIV caucus. Additional resources included community partnerships, panelists, the venue space, of course, and the technology platforms and outreach materials that were developed for this project. We had community engagement, and one of the strengths of this conference was centering lived experience. Storytelling helped connect policy issues to real people and encourage meaningful dialogue. The conference also fostered collaboration between advocates from different states and organizations. Some challenges and lessons learned. One challenge I encountered during this practicum was limited access to some conference documentation due to a change in communication with a former collaborator. So the co-collaborator that worked with me on Ladies First, we lost contact with one another, and it impacted the way I had to develop this. So, but this reinforced the importance of maintaining organized records, shared file systems, and clear documentation practices. It also reminded me that flexibility and problem solving are essential in skills in advocacy work. You have to spin on a dime. So the best practices that developed from this was the key practices I want to share with other advocates are center lived experience. It's always good to center lived experience, build partnerships early, use accessible and inclusive messaging, and consider hybrid formats to increase participation. We did have it in person and online. And the outcomes and the impact of this intervention, of this conference, was it increased awareness of HIV criminalization, it strengthened advocacy and relationships, and it elevated the voices of people living with HIV and created a framework that can be adapted for future criminalization efforts, decrim efforts. And the key takeaway that I'd like to leave with is this practicum demonstrates how education, storytelling, and community engagement helped. And my hope is that this best practice guide will serve as a practical resource for advocates working towards policy change. Again, with the fact that we know the criminalization is a human rights issue. We also used a video that helped bring home the point a little bit more in the in-person event, and it was well received. The people that we hired some peer advocates to work on the materials and to help with the community outreach, and all of that came together to build a collaborative effort. So, thank you. And I wanted to just highlight this picture. This is Melanie Reese in the back of Governor Westmore and of Maryland as she as they signed that law, that bill into existence, and that's her participation in it. Any questions?
Thank you so much, Denise. That was amazing. I can't stop saying amazing. Every time one of y'all show up, y'all show out.
And phenomenal. That part. Beautiful presentation, Denise. Thank you so much.
Great job.
Great presentation, Denise.
Yes, yes.
Thank you.
Wonderful.
Denise has been advocating for a very long time. Very long time. And we thank you for all that you do.
Thank you.
Incredible. Up next, we have Zena.
Hey y'all, how you doing? Can you give me permission to share the screen? And then I can start. Okay. Hey y'all, how you doing? My name is Zena. I am from New Orleans, Louisiana. I am a disabled DJ, poet, artist, actress, HIV advocate, and oral historian, and a bunch of other things. My project is entitled Comatose Festival. It is going to be a HIV and AIDS and STI testing possibility model that will merge broader access to harm reduction resources and in a ambient disability friendly space to people living with HIV, neurodivergent or neurospicy people, disabled, sex worker, Black and Brown, Indigenous, undocumented, LGBTQIA, non-binary, gender nonconforming, and other similarly marginalized groups to erotic and performing arts and nightlife-based education and entertainment events. This festival will be an accessible sit-down nightlife event in New Orleans that will function as a pilot for a publicly funded alternative HIV and STI testing site. The project will combine a closing DJ set, community dinner, performances in the space with a photo booth, film screenings, on-site testing, primary care, legal name change services from Crescent Care, who will be acting as our primary fiscal sponsor, as well as harm reduction resources from iPrevent/Odyssey House, which is a harm reduction and primary care linkage organization. And the main goal of the project was to allocate federal, local, or national funding that goes towards HIV and AIDS management towards alternative testing sites, which I was able to successfully gain by reaching out to my original primary clinic where I was originally diagnosed with HIV about 10 years ago. And so this is also celebrating 10 years of living with HIV and 10 years of being a DJ as well. And so as a Black disabled trans woman, I was injured in 2021. I was in a motor vehicular accident. And so since then, I have been focusing on how to combine my past of being a DJ with where I am now in advocacy and different things. And so as a Black disabled trans woman, I'm leading this LGBTQ-centered space to demonstrate how government funding can support community-based, disability-centered nightlife as a formal part of the testing infrastructure with a model that can be replicated across multiple venues and dates. And so this fellowship that I did is actually a dual fellowship venture alongside me and my co-organizer, Simone Emmanuel, who is a AIDS United Transgender Fellow and the co-director of Loud Queer Youth Theater, a local queer youth theater organization slash fiscally funded project. And she's also an instructor at the New Orleans Center for Creative Arts. And so our event slash project is being funded by The Movement, which is a gay Black focused like organization that provides peer support and events. And they also do things like this, providing alternative testing sites. And so we're being sponsored by them. I'm sponsoring through PWN. Simone is sponsoring through Transgender AIDS United Transgender Fellowship. And we're also receiving sponsorship from a good friend and like someone I look up to, Mandisa Moore O'Neill, who is the executive director of the Center for HIV Law and Policy. And so we're also working with Odyssey House, as I mentioned earlier, and they're going to be providing harm reduction resources and a mobile unit so people can get tested inside or outside of the event. And we're also working with Brandon Dykes from Vive Healthcare, who is going to act as a community liaison and is offering a photo booth. And we're working with the movement Crescent Care, as I mentioned. And so I have been working with some other folks as well over the last year. So that's Mandisa. I've also worked with my co-directors at the Last Call Oral History Project, Indy Mitchell and Jasmine Davis. I've received some PR support, advisory, and consulting from Natalie Rupp and Toby Johnzimis from the Trans Income Project. And I have been offered a lot of event PR support and emergency housing as a disabled person facing houselessness, and an artist residency space called the Deep Spacecraft, which is a grassroots Black and Indigenous-led transitional sanctuary located in New Orleans that operates as a safe haven, providing housing, creative workspace, and community healing for queer, transgender, intersex, and disabled people. It is owned and maintained by Black and Indigenous trans people, and the project was operated to create a housing safety net for those experiencing systematic discrimination, such as myself. And the sanctuary offers transitional shelter and safety, creative sanctuary, mutual aid and accessibility, acting as a physical refuge for people experiencing emergencies. It is also an art house and a studio space for people in the queer and trans community. And it functions as a collaborative third space focused on accessibility and community-driven rehabilitation. Because it is a grassroots organization, it relies heavily on community contributions and micro reparations to fund its utilities, mortgages, and things. And so that's...
Oh, I have 5 minutes if you could wrap it up.
Okay, well, that's basically the gist. And I also just wanted to show you all, this is the flyer that I created for the event. It's going to be on Sunday, July 26th from 7 to 11 p.m. You can find us on Instagram at Comatose, KOM_ATOSE. And if you want to check out our website to learn more, it's comatose.base44.app. Thank you.
I ain't trying to show no favorites or nothing, but them folks from Louisiana, y'all. Great job, Zena. Great job, Zena. That was amazing.
Period.
Absolutely amazing. Yes. Awesome. Y'all have some really great ideas.
Thank you, Zena. Thank you for such a creative project and for really challenging us to think about policy in a different way. So much appreciation to you. And next we have Millicent.
Hey, everybody. Thank you for being here. My presentation, you'll be able to find on the website. I decided not to use it because it was going to take more than 5 minutes. So I'll just explain my practicum. My practicum is entitled Modernizing the HIV Criminalization Laws in Louisiana. My host organization is LCCH, the Louisiana Coalition on Criminalization and Health. So in my practicum, because this is work that I'm already doing, this is why I decided to go this route with my practicum. So here in Louisiana, these laws were created in 1987. They were some of the worst laws ever created. Louisiana had the most harshest, the most strictest HIV criminalization laws. When these laws became in effect in 1987, they were based on fear, uneducation, rather than public health issues and science. So the first attempt to modernize our laws was in 2018. And the Stigma Index Project had a lot to do with that. I was not a part of it, but that was the first attempt that was made. It didn't get very far, and it kind of sort of like rewrote the bill in a worse way than it already was. In 2022, LCCH was formed, and our executive director Deets came on the scene. I wasn't a part of LCCH at the time, but I kind of followed them a little bit, so they started making moves. They made a second attempt in 2022 with a champion, Amy Freeman. A lot of things didn't go right with that attempt at that time, and it was voluntarily deferred. So moving forward on, we did not stop. LCCH kept the boots on the ground. I became a member of LCCH in 2023, and I started learning about policy. I had no idea that it was this intense. It would pull out anxiety that I didn't know I had. But this journey has been a great journey. It's taught me a lot. I've learned a lot. My disclaimer, I still don't have a full understanding of what we are doing and what we have done, but I'm in the house, I'm in the building. Okay. So we made another attempt in 23. No. The next attempt that was made was in 24 when one of our representatives wanted to criminalize our STIs. At that time, LCCH, they had already did focus groups in all 9 health parishes in the state of Louisiana and got a lot of feedback, a lot of information from people with lived experience. With that information, we compiled task force and all kinds of things. I can get that information to you if you need it. So after the bill was hit the floor about trying to criminalize all STDs in the state of Louisiana, it didn't go anywhere. It led to a task force. At the end of the task force, we had chosen our champion, which was Representative Wayne McMahon. He is a super powerhouse in the legislative system here. Like I said, we kept boots on the ground. We sat on Zoom calls. We had telephone calls. We met at the state capitol. We mobilized, bringing different people from different parts of the state of Louisiana here to Baton Rouge to sit in and to testify and sit in on the hearings. I had to testify at one of the hearings. I sat on some of the Zoom calls with representatives. I actually sat on a couple of the Zoom calls with the rep that was trying to criminalize all STDs. At the end of the task force, she finally had a better understanding of why the bill that she was trying to bring was so devastating and so detrimental to the people living in the state of Louisiana. So it was pulled. With that, we got Wayne McMahon, our champion, and we worked hard with the Louisiana District Attorneys Association, because here in Louisiana, if you do not have the Louisiana District Attorneys Association on your side, nothing is going to go through legislative. Not here. So LDAA gave us a lot of pushback on a lot of things that we were asking for. Representative McMahon was our go-between. He'll take our stuff to them and he'll bring back what they said, and it was just like a back and forth forth, just like watching a tennis game, because that's the way we were doing, But you guys, at the end of the day, Representative Wayne McMahon was a powerhouse for us. For us. Our bill went through the House, no oppositions. Our bill hit the Senate, no oppositions. Our bill hit the floor, no opposition. And this is HB 808 that I'm talking about now. And it went back to the House. So basically, our bill passed through legislation without any oppositions. And May the 17th, I think it's the 17th, Governor Jim Landry signed our bill into effect, and HB 808 is now law, or what statute, whatever they call it, 170 Act 177. So we're not through yet. That's just a little bit of what we have been doing since LCCH has formed, and I am so grateful that I am a part of this movement and this amazing opportunity for people living with HIV. Shout out to Dees and Jasmine from LCCH for all the work you helped me do and you helped me put in. Shout out to Williams Institute for some of the information I have. Shout out to CHLP for all of your help and assistance. Thank you, PWN.
Period. Thank you, Millicent. That was amazing. Amazing.
Oh yeah, just so y'all know, they from Louisiana too. What?
Louisiana
in the house.
Amazing.
Thank you so much, Millicent. That was amazing. Congratulations, congratulations, congratulations.
Thank you all.
Congratulations, Millicent. That is not an easy task. That is such incredible work that y'all did on the ground there to get that going. Now I will pass it to Marcia.
I think it's possible Marcia
Hello, can you guys hear me?
There she is.
Can you hear me?
Yes.
Okay. I could not log in because I didn't have good Wi-Fi, so I'm on the phone, and I want to thank you for giving me this minute to speak. I want to show appreciation to Kelly, Helena, Ametta, and especially Myra. I was so flabbergasted by the support that you guys showed me. You saw in me what I didn't even see. I felt ashamed because I did not complete the practicum, but you still saw something in me, and it made me look and reflect. My practicum was supposed to be about, at first, source of income, which means that people who receive housing assistance do not have the opportunity to live in better places because they're denied housing just because of their source of income. I was unable to move forward with that because nobody's actually done any studies on it. So it changed a few times, and I decided to interview some people who have lived in housing developments, and one person had a great experience with theirs, the other one had an awful, and it ended with her daughter dying. I'm not going to talk about my partner agency, but I will say I procrastinated in getting it, and then once I got it, I had no fault of their own because they worked in legislation. I mean, they're always in Montgomery doing the work with the feet on the ground. So he wasn't able to give me the time that I needed to actually discuss things with him. But through it all, I have learned so much. And I know Myra can attest that I'm always depositing this knowledge in our PWN Alabama chapter meetings. This year has been a year in which I've made a big transition. I went from disability to working full time. And I had no idea how much of a challenge that was going to be when I had applied for this policy. In fact, I didn't have the job when I applied. The demands of this job were intense. I had worked with patients with out of control diabetes, and this year we had 5 patients die, and I felt like I was back in the 90s dealing with HIV. This job is so demanding that actually I was warned today that they're going to report me to HR and maybe dismiss me. I really want to say that even though I did not complete the practicum, I still gained a whole lot, and I was able to contribute to our chapter in Alabama. I had to learn this year how to work in the background instead of in the foreground, which is what I'm used to. But I found out that advocacy can be just as effective in the background. And actually the idea that we in Alabama are doing, which is taking our advocacy on the road, was actually an idea that I got from actually listening to some of the webinars that were presented. And I'm excited that it's on fire. I mean, it is fire for Alabama. And so I want to give a lot of praise and appreciate love to my chapter in Alabama, to those of you, to Kelly, Helena, Medic, I've already said it. When I saw that you honored me with something I didn't feel like I deserved, but a certificate, I was practically in tears. So I'm just glad you guys can't see me right now. But I also want to give some appreciation love to everybody here, because out of each one of yours, I was excited, and I could actually see certain things about me. Like, I was diagnosed when I was pregnant and had cancer, and that was in '93. So it was exciting to see where you guys are today and how much has changed, and hearing about the successes. So anyways, that's all. And thank you for this little opportunity.
Oh, thank you so much, Marcia, for sharing your journey. And we understand people work, people have families. We go through all type of adversities, and sometimes the way gets a little hard, but the work, it doesn't just stop here. You all can just keep on going with your dreams and your ideas and be the changes that you want to see in your community. Marcia, it doesn't stop here. We can still get that practicum done and
Thank you so
implement it
much,
here
Marcia.
across
Thank
the
you, Marcia,
nation.
for
Yeah,
showing up.
absolutely.
Yeah.
Yes, thank you.
You did a great job. And I think I absolutely agree with Myra that it is not over. Policy work and advocacy are not linear. I mean, it has ebbs and flows, and just keep flowing. Just keep flowing.
I will say this one last thing. Being a part of this, I got brought into our office today by my 2 supervisors. And because you guys believe in me, I was able to, they told me about where I did not achieve what they wanted to. But I had done a little research of my own about my job and my position. And I told them, in advocating for myself, that this job, you have set people up for failure, because nowhere else in UAB, University of Alabama at Birmingham, are social workers required to do what I do. In fact, there's one person that does part of my job, and there's another person who does the other part. And therefore, there was no way. And the achievements that they had did before was because they were doing something that was illegal, which was when they had medications, they were reallocating it to patients who it was not originally assigned to.
Wow.
When I came on board, we stopped that. Yeah. So when I came on board, I pointed out that I had to do it without that.
Thank you, Marcia, for showing us just the importance of vulnerability in this work, and also the requirement that we have to advocate for ourselves too, right? Not just the policies that we want. So much appreciation for you for continuing to show up. Yeah, much gratitude. And next up, we have Renee. Over to you.
Hey, everybody. Can everyone hear me?
We hear you.
All right, beautiful people. If you feel beautiful today, dust your shoulder off. Yeah. Okay, that's so important. Hi, everybody. My name is Renee. I am one amongst many things. I'm one of the members at large for the New York Transgender Advocacy Group, and I'm happy to be here with you all today. Shout out to all the fellows. Shout out to Helena. Shout out to Myra. Shout out to all the staff at PWN. Shout out to Kelly. And all the fellows for being here doing this and fellowing. So I worked with many organizations with the help of Amir at CHLP. I also want to give a shout out to Rico at TAG on my project idea, digital security vulnerabilities for people living with HIV and AIDS in provider settings. And so I'll just give a brief overview of what I've got going on. The subject matter of digital settings has received attention within the past 5 years. The issue is that protected health information is covered by the 1996 Clinton-era Federal Act HIPAA, Health Insurance Portability and Accountability Act, which seeks to, amongst many objectives, protect protected health information. It has undergone several amendments as a federal act, including the 2003 HIPAA Privacy Rule, the 2005 HIPAA Security Rule, the 2006 HIPAA Enforcement Rule, and the 2009 HITECH Act, as well as the 2013 HIPAA Omnibus Final Rule. These amendments establish standards for protection, secure electronic protected health information, outline civil fines and procedures for investigations, establish HIPAA's data breach notification rule, and finally include liabilities. The 2016 conservative turn in the United States administrative bodies has undoubtedly played a role in the marginalization of digital health privacy as a regulatory concern, as ease of regulation remains a hallmark of conservative ideology. However, Health Gorilla, a health data network, which was the subject of federal lawsuits where at least 300,000 patient records were compromised in a fraud scheme, became the subject matter of HIPAA. Digital security vulnerabilities such as these have a negative impact on patient access to privacy. Patients at the intersection of multiple forms of stigmatization, marginalization, and minoritization, particularly people living with HIV and AIDS, are especially vulnerable to the negative impacts of digital security vulnerabilities and the laissez-faire culture of privacy they create. So my white paper policy brief is still in works, still happening, right? But in short, what I'm discussing is access to privacy and how people like myself who've been living with HIV 10 years. I'm 27 years young, and I was diagnosed in 2016. And so even folks like myself who are long-term survivors and are out and proud and loud, okay, about our positive serostatus, our positive HIV status, we face a differential in the access to privacy that we may have. And what this does is it creates a multiple situations in which our health information, most particularly our positive HIV status, is vulnerable to being shared with providers, with private companies. Okay, so wearable technology, third-party cookies that are on wearables that are on computers, right? All of these different data sharing programs and policies don't really have our best interests in mind. And while at different places and points across the United States, such as here in New York or maybe in California, there are state level policies to address these security vulnerabilities, which happen at a massive scale, as I've said, right? At the federal level, that is what's most important, right? And so in our post Trump America, I know that's hard to imagine, but it's coming, girl. It's coming. In our post Trump America, HIPAA will change, right? And so we have to be brave and bold enough to think about the changes that we want to make to HIPAA. And HIPAA seems like one of those things that can't be touched. We're very hands off about it, right? But we can't create a political landscape or even a health landscape in which only folks in New York or only folks in Miami or Houston or Los Angeles are protected. We have to think about folks like where I'm from in Detroit, right, who also need protection by federal policy, right? And so my call to action with this policy project is to think about privacy as care, right? And so we need to think about privacy from the top down, from the health system managers, right, who are managing our data, to nurses who get to access our information, to even us as patients, right, who are mingling amongst and between each other and recommending who we think is the best provider for our care as people living with HIV. We have to do away with what I call a laissez-faire culture of privacy and be a lot more serious about our status, because I can go on Grindr right now and see a lot of people's HIV status, right? And we think that that is good, right? That folks are able to share this information so widely, but we also know that this is information for which folks are criminalized at the end of the day. And so it's really important to think about privacy as a form of care. Thank you all. I hope this was meaningful. And yeah, that's it.
Fuck it. Fuck it.
Hey, yes.
Great job. Yeah, that was hot. That was hot. That was right on, right on. Because I hadn't even thought about that. That's the fact that we have fellows that are thinking on those lines is absolutely amazing.
Yeah.
Thank you so much.
Really is. It really is. Yeah, and I can't wait to see it trickle down into the rural areas. Every last presentation.
That was beautiful. Thank you all so much. We just want to honor one other fellow who couldn't join us tonight. El Tang was an incredible member of this fellowship. They were not able to be here tonight. Their project is on weaving peace, the dual decriminalization mandate for global health, dignity, and justice. It is a framework on HIV decriminalization and sex work decrim, and their host organization is the Best Practices Policy Project. So we just wanted to honor them in this space because they were a huge part of this program.
Yes.
And other than that, thank you all for sticking with us. Thank you for coming to celebrate these incredible individuals that we've had the privilege of learning with and from. It has been an incredible 10 months or so, right? More than that for you, Kelly, Meta, and Myra. 10 months for me. So much gratitude. And we know we're over time, but we'll still play some tunes. And if folks have anything to share or just want to share space, we'll be
I just
here.
want to thank everybody for just really allowing me grace. I appreciate your patience. I appreciate my team, and y'all have done a phenomenal job. And okay, so what if I'm a little prejudiced about the folks from Louisiana? That's where I'm from.
Yeah.
Good job, Louisiana. Everybody did a great job. And some of the things that
Everybody did
y'all
a
did
wonderful
policy
job.
work on is phenomenal.
I
Really
am so
phenomenal.
proud of you all.
Girl, you taking my word. Phenomenal.
I love you too, Olivia.
I am very proud of you all. Congratulations.
Yes, yes.
Great presentation.
I love you all
Great
too.
practicums.
Congratulations.
Congratulations.
Cool.